This is In Step with Compliance, a podcast by the Modern Practice Solutions team for dental professionals.
Welcome to In Step with Compliance. My name is Olivia and I'll be your moderator. This episode is sponsored by Modern Practice Solutions. And we're excited to talk to Caitlin Dennison, former OSHA inspector and dental hygienist, about her thoughts whether dental practices are in compliance with amalgam waste management. So Caitlin, let's get this episode started and get your thoughts about what's going on in dental practices as you make site visits.
Yeah, I think at this point, most dental practices are aware that most practices, now there are some specialties that are exempted, but most practices are required to have some kind of a device to ensure that when they're suctioning amalgam, that does not go into general wastewater. And the reason for that is amalgams, of course, do contain some amounts of mercury, and we don't want that in the environment. It's an environmental toxin. And typically, the biggest issue we see is not so much that practices don't have anything in place, but they're unsure of the requirements for documentation and for maintenance. So today we're going to kind of chat about how we can make sure we're fully in compliance with this regulation.
So talk to us about some of the products out there that we see commonly used in dental practices. What do you see with amalgam separators?
Yeah, so there's a couple of different options. Typically at larger practices that have multiple operatories that are going to potentially be handling amalgam, they're using more of a practice-wide device like the Solmetics device, which is a filter that connects to your central suction. So whatever gets suctioned out of your operatories goes all the way back to this filter. It's all collected, and any amalgam pieces are filtered out before that waste enters the wastewater system. And again, this is good for larger practices where multiple operatories are going to need to use this throughout the day. Alternatively, some smaller practices who might not be doing amalgam procedures frequently or might not have a need for this filtration constantly may use a handheld device like the Dove Capdol device, which simply attaches to the suction and filters right at the point of suction. So amalgam comes right out of the mouth and into that filter, then the entire suction device is disposed of. So it's a one-time use attachment for your suction.
So Caitlin, how would they dispose of that Capdol device? Is that specially handled waste?
Yeah, good question. So remember that the Capdol device is capturing all of that mercury containing amalgam, so we can't just throw it back in the trash, right? That would defeat the purpose. So Dove will send you with this device a nice little amalgam box where you'll dispose of that device and it will be appropriately recycled. Same with the filter. For a Solmetics filter, you will also receive a disposal container where that waste will be appropriately disposed of. You'll ship it off.
And I actually have some samples from Dove for the Capdol device. If any of our listeners would like a sample, I'll be happy to send it out. And I'm sure you can go to Dove's webpage and they would be happy to send a sample as well. Now, what about the care of the products, specifically if they are using the amalgam filter from our friend Solmetics? What are some things that the dental practices should look out for, Caitlin?
Yeah, so just like with, I guess, any filter, an air filter or a filter on your fridge, it's going to get kind of clogged with debris. And it's really important that that filter is functioning optimally because we want to capture the highest quantity of amalgam possible to, again, prevent that environmental contamination. So importantly, at the dental practice, it should be one of your regular tasks to check this filter on your unit and ensure that it's not clogged, it's not overfilled. We recommend putting this as a calendar reminder, maybe on your practice management calendar. This is the day however often we go in and double check this filter. And we like to remind everyone that, as with everything compliance, if you're not documenting that you're doing it, you're not getting credit for it. So document these checks that you're doing regularly.
And how many times, Caitlin, have you or myself gone into the dungeon in some of these offices in the basement, and we look at the filter. We personally look at it, lay our eyes on it, and we are taking photos of violations because they are over the fill line. So, maybe it's anticipated that the filter will last a year, but when we have busy dental practices, high volume, especially floating through our treatment rooms, then it will fill up faster. So I love the idea of calendaring this task so we don't overlook it. So those are important points. And then, Caitlin, what about the EPA rule? Where are some of these resources that practices can consult?
Yeah, the EPA actually did a really good job when they came out with this regulation of providing guidance. And if you simply look up, and in our blog, there is a link to this, it's the EPA page for dental effluent guidelines. They have really well laid out exactly what you need to do. It explains if you're exempt, some specialties are, and what paperwork you'll need to file. That paperwork, there's an initial compliance report. Likely, I always tell practices, likely you already filed this, hopefully, when you initially got your amalgam separator. But if you haven't, you can find this report on the EPA's site. And that gets filed with your local wastewater authority. You can find a list of those online as well.
And sometimes the municipalities in certain cities, especially metro cities, will have an additional layer of compliance. So we'll have all these resources that Caitlin compiled in the blog version and available with the podcast as well. We appreciate all our listeners tuning in, particularly on this topic on why dental practices need to know about amalgam waste, both in treating patients and protecting the environment. So once again, thanks for tuning in, and we'll see you next time.